Hi everybody, it's Elliot here from East Coast Podiatry in Singapore, and today I'm joined with Gabriel from Temasek Junior College, who's going to be asking me questions about ankle sprains within basketball.
Good morning, Elliot. My first question would be, what causes ankle sprains?
For everybody at home, an ankle sprain is either a medial ankle sprain or a lateral ankle sprain. This is the more common one. An ankle sprain is where the ligaments or the tendons that are responsible for securing the ankle are damaged, and this will be accompanied with lots of swelling, maybe some bruising and pain upon movement. What causes ankle sprains? It can be a combination of things. It could be that you've had previous ankle sprains in the past. This will leave the ligaments very lax so that the integrity is no longer there. It could be that you've also landed incorrectly. If we're talking about basketball players and they've gone up to jump and land and they've landed incorrectly on the outside of the foot, the whole ankle will invert. That will cause a sprain. Footwear as well. Sometimes people wear the wrong shoes, which causes their ankle to be unstable.
My next question would be, why are ankle sprains so common in athletes such as basketballers?
With basketball, a lot of jumping up and down, forward, sideward action. If we're talking about other athletes in tennis, jolting from side to side on the court, that will cause lateral ankle instability. If we talk about football players, the boots that they wear are not very stable. They're very thin, they're very lightweight. So if they land incorrectly or they take the wrong step, there's nothing to secure the ankle and the whole thing will roll in, and then it will just damage all the tissues.
Next, I would like to ask, do ankle sprains become chronic over time? Why?
I get lots of patients come in after having ankle sprains. They will tell me, I had an ankle sprain like 5 years ago, but I'm still getting pain. So if you look online, it will say rest. However, they get an ankle sprain, they'll rest for 1 to 2 weeks, and then they're back to their sporting activities. The ligament or the tendon has not properly healed, and what you're doing is you're causing scar tissue. Now, this scar tissue is what causes the pain.
How long does it usually take to recover from an ankle sprain?
Okay, so there's 3 different grades, right? So you've got the first one, minor sprain. The ligaments are still intact, just some swelling. That could be gone from 1 to 3 weeks if you rest amply. And then if we go to grade 3, full rupture, that could take up to 2 months, right? So you may have to go for surgery, or you may have to do shockwave to try and heal the ligaments and offload it in a boot, but that could set you back for about 2 months. Because remember, what we want to do is make sure you don't have that scar tissue over the site, because later in life when you want to still do your sports, if you don't heal it correctly, you'll still feel the discomfort.
Why do poor fitting shoes make it easier to develop ankle sprains?
So with basketball shoes, they're all high tops, right? So the reason they're high tops is so that your ankle is fairly well protected. With some shoes at the back, they will have what we call a varus post. They're mainly given to people with flat feet, but the trouble is, because they're trendy shoes and they look good, they've incorporated it into a lot of different shoes. And people don't know, if you're high arch, you're not meant to have it, because if your foot's already neutral and then you're wearing a shoe that knocks your foot out like this, you're more likely to get a lateral ankle sprain. Great question.
My last question to you would be, among the various treatments, what is the most effective way to treat severe ankle sprains?
The most effective way, if we talk about the majority, and the majority will be within grade 1, grade 2, is RICE, rest, ice, compression, elevation. Reduce the swelling and get the patient to reduce all physical activity for about 1 to 2 weeks. But obviously, if we're talking about grade 3, it becomes a little bit more difficult and there's a bit more of a duration in place. And then obviously changing footwear, manipulating the pressures underneath the foot to try and prevent the ankle from becoming unstable is also very, very important long term. Thank you, Gabriel, for coming down and all your questions. I hope it's very educational for yourself and very educational for everybody at home as well. If you did like it, please like and leave a comment below. And if you or anybody else you know is suffering from an ankle sprain or a chronic ankle sprain, please go and see a podiatrist today for a foot assessment. Okay, take care.
Thank you for watching. If you find our podiatry videos informative, please like and share them with someone who might find them useful. If you need to contact us or find one of our clinics, go ahead and take a screenshot now. To subscribe, you can click this button over here. See you in the next video.